Good morning. Today is Thursday, December 17th, and this is our weekly COVID-19 update briefing. Unfortunately, the parish has experienced a large increase in positive tests this week. We have an increase of 507 since the last briefing, and we now have 7 more deaths, bringing our total deaths to date as of this morning to 170 in the parish. We had some good news recently. The governor has said that we're seeing the light at the end of the tunnel, and he's, of course, referring to the firms of Pfizer and Moderna coming out with a vaccine that is up to 95% successful. This is a really big deal. It's gone to the Food Administration this past December 10th, and they have approved it for immediate use, and it is being distributed as we speak. The Pfizer has the unusual characteristic of having to be transmitted in ultra-low temperature containers, but that said, that's 94 degrees Fahrenheit, but they are being distributed all through the United States to the primary persons selected for this. To be effective, it takes 2 of these immunizations shots to be maximum effectiveness. So Louisiana is getting initially 39,000 shots, and 21 days later it would get the second shot to achieve the full 95% effectiveness. Moderna, the FDA is going to be meeting today, as a matter of fact, to consider approving them, and it's highly likely that they will also be approved. So when that is said and done, the Moderna shot, like the Pfizer shot, requires a follow-up shot, and it's 28 days later, so 21 days for the Pfizer and 28 days for the Moderna to get the follow-up shot. And there's also other vaccines in the pipeline that look promising, and there's even a home test kit in the pipeline that's still under development that looks very promising. The governor has recently said that, and it's very, very true, that Louisiana has entered a new and very dangerous third surge of the COVID. The number of positive cases, the increased hospitalizations, the increase in deaths, and the impact of all these has had a tremendous impact on the medical staffing and hospital capacity, and that resulted in the governor having to make the decision to regress us into a modified phase 2 on November the 25th, which runs through December the 23rd. The governor has repeatedly said that all the information we're getting from the White House task force and medical experts said we're in for a couple of really tough months, and that's very, very true. We're seeing record numbers of cases and deaths throughout the nation and internationally, for that matter. The experts expected increase in positive cases now that cold weather is upon us and more people are staying inside. And unfortunately, that prediction of a couple of tough months is here. We are definitely experiencing them. The governor also cautions that we should not expect to reduce restrictions just prior to Christmas. It's likely that his orders in the modified phase 2 will be extended through Christmas and New Year's. He's hopeful that he'll not have to put in more restrictions but during the holiday season, but he has not ruled it out. Hospitals have indicated that on the latest trajectory of cases, if continued unabated, will overwhelm their facilities. We simply must not overwhelm hospital capacities to deliver health care. Many hospitals are now at or near that point. Last Monday, the governor had a conference call with CEOs of the state's 20 largest hospitals, and they've said they're challenged with capacity, especially with staffing, the nurses, the doctors, all the technicians. The governor has conceded that strict statewide enforcement of his directives is not feasible. He has stated that if people insist we enforce our way through this, we're doomed to failure. He urges that we be good neighbors and voluntarily and consistently comply with the prevention and mitigation protocols. Determining priorities for the receipt of the vaccine and the logistics of distributing have been determined and implemented. U.S. Health Secretary Azar has stated that Louisiana's delivery plan was one of the 4 very best in the nation. The first being vaccinated are healthcare providers and hospital employees and individuals living in nursing homes or assisted living facilities. The state is, as I said, is going to receive a total of 79,000 vaccines. And it's said that to achieve herd immunity, we have to have about a 65 to 75% use of the vaccine, and I'll discuss that a little bit more later. The firms of Walgreens and CVS have been contracted to play a major role in the distribution and taking of the vaccinations. Also, FedEx and UPS are performing key roles in the distribution of the vaccines. As I alluded to, there's a concern that when the vaccines are available, there will be a reluctance by some individuals to take the vaccine. Some people have legitimate medical and religious reasons to avoid immunization, but as I said, if an insufficient number of people do not receive the vaccination, we may not achieve that herd immunity that's necessary to protect the spread of the virus. There was a poll recently taken that is a little bit more promising. Now the poll just taken by the Kaiser Family Foundation indicates that respondents are becoming more receptive to receiving the vaccination. And as of early December, the poll indicated some 71% of our populace is willing to take the vaccination. Former presidents Obama, Bush, and Clinton have publicly stated that they are willing to take the vaccine to demonstrate that it's safe and effective and to encourage the general populace to get the vaccination as soon as it is available. I plan to take it as soon as I am eligible. Local Dr. Philip Roseman has noted that the faster we vaccinate high-risk individuals, the quicker we will see lower deaths and hospitalization rates. And Governor Edwards remains confident it is safe and effective to receive that vaccine. As we know, the number of people who are asymptomatic is about approximated to be 50%, but as we point out every week, they still have the virus within them and can distribute it to others, causing illness and deaths. Wearing a mask remains a major issue of concern, and the directives are that every individual in Louisiana 8 or older shall wear a face covering over the mouth and mouth when inside a commercial establishment or any other building or space open to the public, whether indoors or outdoors, and this includes public and commercial forms of transportation. The CDC has recently recommended that children as young as 2 years or older should wear a mask, but that's just a recommendation. Currently, there are concerns that the spread of the virus through small gatherings, things such as weddings, the Christmas celebration, the New Year's celebration, the holiday break from schools and colleges, where people tend to let their guard down. The concern is there's going to be another surge as a consequence of those. The prevention and mitigation protocols, ladies and gentlemen, remain as always, and we want to review them as always to make certain everybody knows the things that they can do to help prevent and mitigate the impact of the virus. First and foremost, wear a mask. Secondly, wash your hands at least 20 seconds. Cough into the bend of your elbow. Do not touch your face and disconnect surfaces which are frequently touched, such as doorknobs, handrails, typewriter, computers, etc. The next thing you can do is practice a social distancing of at least 6 feet. When you're sick, stay at home and follow the advice of your medical provider, and as always, avoid crowds. The next thing we should be doing is getting a flu shot and doing it now. The CDC and the governor urge everyone to get the vaccination to help prevent the potential of compounding the problem of having both flu season and the COVID-19 pandemic at the same time. So get the flu vaccination now and take the COVID-19 vaccination when it becomes available. There is more good news also. In the last week, a major change was announced by the Center for Disease Control and Louisiana Department of Health concerning the number of days a person should be in quarantine, and it is as follows. The CDC is now allowing quarantine time to be shortened to 10 days on the 11th day if no symptoms have been reported during the daily monitoring. And the quarantine can be shortened to 7 days on day 8 if the individual takes a COVID-19 test and receives negative results. The Louisiana Department of Education has given schools systems the green light to go ahead and start these relaxed quarantine rules at its 1,700 schools. The CDC hopes these shorter quarantine periods will encourage more people to receive the vaccination. And the Louisiana Department of Health is still recommending the 14-day quarantine period for residents and staff of congregate living facilities such as nursing homes and correctional facilities. The 14-day period still provides the maximum reduction of the post-quarantine risk. I want to thank all of you for continuing to participate in our fight against the pandemic, especially at this critical time when the nation's ability to provide the needed health care is in serious jeopardy. Our next briefing will be next Thursday, December the 17th. I wish you and your family a very Merry Christmas and a happy, healthy New Year. This concludes our briefing for today. Thank you and good day.